And now for our Honorable Minister of Health, the Honorable Dr. Frank Anthony.
Thank you very much, Mr. Speaker, honorable members. First of all, I want to thank Dr. 𝐁𝐔𝐃𝐆𝐄 and his staff for another excellent budget, guaranteeing everyone in Guyana will benefit from this budget. Whether you're a child or an adult, whether you live in the hinterland or on the coastland, whether you work for a business or you own a business, there is something for everyone in this budget. But, Mr. Speaker, over the last couple days, we have been listening to the various presentations. And, you know, as valiantly as my colleagues have been trying to explain this budget to the opposition, it is like trying to explain quantum physics to a goldfish. They just don't get it. Mr. Speaker, Guyanese across this country are happy and satisfied with Budget 2025. They know that their health is in safe hands. Their education is assured. They have jobs and job opportunities. They have better roads, better security, and they can now own their own homes. These are unprecedented times, Mr. Speaker, when the lives of every Guyanese are being transformed every day. People are proud of their country. Every day, people across various communities are joining hands with this government to build a one Guyana, a prosperous Guyana, where the aspirations of our motto, one people, one nation, one destiny, can be fulfilled. Mr. Speaker, while optimism reigns eternal among our Guyanese brothers and sisters, listening to the APNU and AFC members, one can only deduce that they reside in an alternate universe, detached from reality. Over the past few days, their presentations have exposed their shallow understanding of the economy, the budget measures, and of course, the aspirations of the Guyanese people. And when they fail to advance any cogent arguments, they fall back on the usual tired innuendos and misrepresentation. Mr. Speaker, the Guyanese people have grown weary of their negativity. We are fed up of the rhetoric, and we had enough of your empty promises. The public is not deceived. While some of those on the APNU benches, their faces might be relatively new, but they peddle the same old divisive message: nothing novel, nothing constructive. Mr. Speaker, looking at the APNU, one can not help but feel sorry for them. Imagine the AFC divorce the PNC, or vice versa. We are still to find out. But while they are divorced, they are still co-inhabiting in this house. APNU is now what I should call an oxymoron. It is a divided coalition. Imagine they can't run their own house. You can't manage your own coalition. and you want to come here and lecture us on how to run this country. We would not allow that, Mr. Speaker. Mr. Speaker, let us examine their tenure while they were in government. And I'll just stick with the health sector. There's a famous Michael Jackson song, and in that song, I think the title is, "Do You Remember?" Many of you might know that song. So I want to say, do you remember this Success Street bond, the scandal there, where apparently a friend, maybe a family, maybe a favorite, or a flatterer, they were given a contract. They were given a contract to store pharmaceuticals. And when they were storing the pharmaceuticals, they gave the man $25 million up front so that he can then go and buy the property. And then after buying the property, he turned back and he rented to the APNU AFC for $12.5 million a month. But that was not all. That was not all. He rented it because they gave him a contract for 3 years. And so one would have thought that having paid so much money for this bond, that they would have utilized the bond. But then when you go to the Auditor General report, they said from July to August 2016, nothing was in the bond. Yet we were paying $12.5 million per month.
That's what you call friends and family.
And not only that,
Call friends and family.
when they finally put something in the bond,
Who really get him on?
it was on the 1st of September 2016.
That's what you call friends and
That's when they put something in the bond. And then the something, we can go to the something, because they had some contraceptives and some other things that they were storing in the bond. We also had a parliamentary visit to that bond. And when the parliamentarians went there, we found that they were also, apart from the contraceptives, they were also storing an old CT scan machine. And Mr. Speaker, if we add up the cost per month for this 3 years of $12.5 million, we could have bought a better CT machine than they had storing in that bond. And I know the comrades on the other side, they like to ask for us to lay over the document. And I'm happy, Mr. Speaker, to lay over the Auditor General's report on what happened at Sussex Street. It's a very big report.
As Rohi would say, the evidence. They want the layover.
Mr. Speaker, I come back to Michael Jackson.
And they wonder why they're sitting over there.
And again, they said, the song said, "Do you remember?"
What about the man in the mirror?
So do you remember
The man in the mirror.
the HDM drug procurement scandal? This is the report, another Auditor General report of what happened during that period. And we can go there.
You just had a moment.
So here, you had in this report, you had a tender, a selective tender that went out. 6 companies were selected. But when the people tender and it went in, apparently the preferred company was not one that had the right price.
Oh, so they canceled it.
And so that tender was cancelled. And they did a second tender. And when they did the second tender,
He get it again.
the preferred company alone put in a tender, and then they were awarded the contract. And according to the Auditor General's report, many of the items on that second contract, if you did a comparison between what was proposed in the first thing before they nullified that bid, or that selective tendering, if you compare the two, you would have seen on the last occasion the preferred bidder that got the contract, HDML Labs,
HDM Labs, that's the one. That's the one.
they then
That's correct.
had many of the items
Another
that were far higher than most of those that were in the first set of tenders that they nullified.
and favorite. That's the same guy who tried to get the. Who was
That, Mr. Speaker, talks about how they were managing during that period.
Mulder, Norton, or Cummins? Who was the
But it's not only that, Mr. Speaker.
Hard that thing. Another prominent Afro.
Drugs and medical supplies, according to the Auditor General, were constantly out of stock. And in this report of the Auditor General for the period 2015 to 2017, when they did the audit, they said the facilities, 43% of the supplies were given to the facilities. 43%, they did not have enough supplies for the health centers, hospitals across this country.
Wow.
Not only that, Mr. Speaker, the waiting time for drugs to go to a health center was on average 50 days. So when you put in a crib at the MMU, it took you at least 50 days to be able to get your drugs and medical supplies. But then the Auditor General did a very interesting thing. They took some random facilities and they went and they checked to see for some items how long they were out of stock. And let's look at Soddy Hospital Pharmacy. There was a medication there, potassium chloride injection, that the people in Region 2 wanted. And you know how long they put in this order and how long they took to get the order? 742 days. They were waiting for this order. Not me making it up. It's in the Auditor General's report. And I lay it over so that you can get it. I lay it over so that you can get it.
Don't worry with the days part, man. Just tell me how many years.
Leg 1 and Diamond Hospital, they were out of metformin tablets for 650 days.
Gosh, another
They couldn't get metformin tablets, essential to treat diabetic patients. Bartica Hospital, to treat malaria patients, they needed quinine. Quinine was out of Bartica Hospital for 1,028 days.
Don't worry about that.
That's a mining community. And they needed quinine. And here in the Auditor General's report, because I hear somebody saying that's a lie, it's in the report. 1,028 days they couldn't get quinine tablets.
That's how they're running. Look how my file running now. Look how he's running.
Linden Hospital Complex was out of snake venom for 1,600 165 days.
They basically never had it.
Hydrochlorothiazide for Cotton Tree Health Center. Diuretic. It's a diuretic. Right? They were out of this medication for 500 days. 500 days. And let me address the Panadol for you, Honorable Holder. In December, Dr. Carter had received in December 2024 6,000 Panadol tablets. She didn't say that though. She didn't say that. 6,000 tablets. And we can go to the crib and we can see that there's 6,000 tablets that were delivered to the health center. So we can talk, but that's the fact. We can talk, but that's the fact. Bring her. Bring her. I'm happy that she spoke. I'm happy that she spoke. 6,000 tablets, and I have the crib to show it. So, Mr. Speaker, lie is not a parliamentary word, but I'm telling you, and I have the crib to show it. I have the crib to show it. 6,000 Panadol delivered to that health center in 2024. 2024, it's there. You can go and find out. You can go and find out. So when you come here and you reference to Mary, you must know, come with the facts. Come with the facts. Because under this government, the supplies of pharmaceuticals is at 90% across the system. Compare with your 43. Compare with your 43 and dismal record. This here is the Auditor General's report. And Mr. Speaker, I'm happy to lay it over so that they can get a copy. Mr. Speaker, again, do you remember the Port Kaituma Hospital? Millions of dollars spent. And when we took over, it was still incomplete. And again, I know they like to doubt. Again, the Auditor General report will tell you what it was like and all the things that were incomplete at the hospital. Mr. Speaker, do you remember the head office of the ministry? Again, this was another project. And in that project, they were supposed to do it for $300 and something million. The project ended up costing $800 and something million. And when we check how the money was spent, the man was paid up front and didn't deliver on the project. Another Auditor General's report. And we can see in the report, it's here. And then, Mr. Speaker, I wonder if everybody can remember the COVID hospital. The COVID hospital. Another Auditor General report. Another Auditor General report.
$1 billion.
Here was the Auditor General's summary of findings. The facility is currently inoperable. Works on the electricity supply network for the main building and the backup generator were still in progress. Elevators are still to be installed, along with the medical gas installation, while interior finishing works were still in progress in one section of the building. Exterior works, the triage shed, access bridge, and gate were also incomplete. And he said they didn't know how these contracts were awarded.
They didn't know how the contracts were awarded.
The criteria used and the basis for selecting the contractors to execute these works under the respective lots is unknown.
Unknown. The Auditor General.
So this is how they were procuring.
I wish I knew this. I would have bring this in my speech.
Mr. Speaker, and you have a whole litany. You have a whole litany of things that the Auditor General pointed out. Mr. Speaker, apart from all these mishandling, mismanagement, incompetence, the failure to prepare for COVID-19 and the subsequent disease management was one of the most monumental failure of the APNU AFC. Monumental failure, Mr. Speaker. This, Mr. Speaker, was their plan. This was your plan for COVID. I got a copy here. Let me read part of this plan to you.
Tell them how to close the border by the quarantine rebel.
Let me read part of the plan to you.
A week before the election.
In the last section of your plan, it says periodization. It says periodization. You remember this plan? Mr. Speaker, I want you to listen carefully to this. It is projected that the presence and threat of COVID-19 will remain in Guyana for between 8 weeks to 4 months. The APNU AFC, in their plan, said that COVID in Guyana would be here between 8 weeks and 4 months. 8 weeks and 4 months. Wonderful. And this is their plan. And the first part of the plan, it went on. It says Guyana has completed the initial phase of discovery and confirmation of COVID-19. This was after we found the first patient on the 11th of March. And now we are engaged in the second phase, which is contact tracing from patient 0 as well as others. And then they're going to go to the third phase, which is likely hospitalization. Mr. Speaker, Mr. Speaker, let's review how they were managing COVID. First of all, there was a lack of PPEs. This country did not have N95 masks. In fact, they didn't have the regular mask. And not only that, and I can tell you, because I had to get N95 masks for those doctors who are working at the accident and emergency. When you fail, we deliver.
And you were doing nothing.
When you fail, we deliver.
Yes, yes.
I brought in N95 masks and give it to the doctors working at accident and emergency.
They did not bed. They didn't even bed in the Coop hospital.
What about testing? What about testing?
They had to test them at Congress Place.
PCR test, Mr. Speaker. PCR test, Mr. Speaker. The first.
The minister had to.
Why y'all hear this?
Yes, Frank.
Why you hear?
Hear it.
Yeah, go.
Hear it.
The first PCR test that they did was on the 10th of March. And we got the results shortly thereafter, which means that's how we know that the first patient had COVID. We took until the 10th of March to be able to do a PCR test.
Imagine that.
What happened before? What happened before? Nonsense! What happened before? So between January and March, you did no tests.
None.
You did 0 tests.
None.
That's why we didn't know how many people were sick with COVID. That's why we didn't know how many people died from COVID between January and March.
Infected. Innocent people
They're
were
trying to rig
infected.
the election.
And this is the truth.
While she was busy signing
They're trying
SOPs.
to rig the election. That's what they
And while
Busy signing SOPs.
And while you were doing that, when the people test at the lab, they had to send the result to you
Yeah.
for you to vet it.
Before it released.
And then when you vet it, then you can pass it on to the doctors.
Meanwhile, she was signing
Meanwhile,
SOPs. She was signing
Meanwhile,
SOPs.
the patients were suffering.
Dr. Lawrence, yes, Dr. Lawrence. Dr. Lawrence.
We had few isolation rooms.
In between signing
We didn't have hospital beds.
signing
No
SOPs.
hospital beds.
We didn't have ventilators.
Bandit.
No ventilators.
When you go in the hospital, you gotta stand up.
And Mr. Speaker,
Floor, you gotta lie down on the
they were proud to announce that they had a national task force headed by the Prime Minister, and it comprises of several other ministers of government. And they oversaw, Mr. Speaker, this task force, they oversaw this grand effort of incompetence. One of the achievements of the task force, they took, Mr. Speaker, more than 2 or 3 months before they can set up the secretariat for the task force. 2 to 3 months.
To set up the secretariat.
Yeah.
You know why? They were busy attempting to steal an election.
They're busy DNA, so trying to cook up the numbers.
And then
That's correct.
one of the other
Waldo was busy signing.
undertaking of this task force was that they also wanted to name, this COVID hospital. So, Mr. Speaker, when you go through the minutes of the task force, they spent a number of antagonizing weeks and months trying to decide the right name for this hospital that they were going to build.
And signing the SOP, don't forget,
And I have all the minutes. I have them all.
busy signing the declaration for Region 4.
Tell them.
So they started out by saying the place was a sanatorium. And then they changed and they said, you know what? We should name it the Infectious Disease Hospital. And then they invite the president to go cut the ribbon and declare the place open. Right? And that was done on the 30th of July. And then
Testing, how you know it is
when they cut the ribbon and declare the name and of the place, then they went back because they felt that the name was not a suitable name. They went back and they renamed it Center for Disease Prevention and Control. So that's how they finally named the place. But when you went in the place, what did it have? It was a shell,
Had nothing inside.
not a bed,
Nothing inside.
not a ventilator,
Useless.
not a Panadol
Useless.
was there.
All of you. Useless.
Nothing.
Useless Apnu.
And you opened the place to welcome visitors, to welcome patients to go there.
Visitors, they want patients. It's visitors they want.
Useless Apnu.
Because there was a
Mr. Speaker,
And incompetent.
one can only wonder what was the terms of reference
they were planning to
of this task force. Was it really preparing to fight a pandemic? Or were they busy? Were they busy using COVID measures to thwart democracy in this country? Let's go through that.
Here was your record. Blank checks, blank checks.
Let's go through that.
You blank check. Blank
It is now a fact. It is now a fact that APNU tried rigging the elections on the 2nd of March. It is also a fact that it took months before we got accurate results of the last elections. During that time, the COVID-19 task force imposed, one, a curfew from 6 p.m. to 6 a.m. as if this virus was only operating in the night. That curfew was started on the 3rd of April 2020. What about the closure of the airports? On the 18th of March, they went and closed the airport to international travel. And you know what was the effect of that? That was to ensure they drive all the international observers away from Guyana.
Yes, yes, yes. They didn't want.
Honorable Minister, we will have to get you an extension to continue with this presentation.
I'm afraid, yeah, I have a different calculation for Minister, Mr. Speaker. So I was just wondering, could you double check like the last time for me? Your timing? Because I have a different recorded time here for him. Could you just double check for me?
I have him starting at 5:48.
I am starting at 5:50, so, yeah. But even so, yeah, okay. I have to then ask that he be given 5 minutes to continue, sir, to conclude, sir.
Thank you, Honorable Minister. You may continue.
Thank you very much, Mr. Speaker. Let me just finish off this idea. Mr. Speaker, right here at this convention center, when we wanted to do the recount, Minister Ben, as one of the commissioners of GCOM, when he came here to observe this arrangements for the recount, he was thrown out, and the police marched him out, and you had that famous protest right behind here. But not only that, Mr. Speaker, what was important was that to prevent the recount or to delay it, they then came and used an insecticide to spray this place to prevent the recount. Y'all remember that? The insecticide don't kill the COVID virus.
You could run, but you can't hide.
They don't kill COVID virus, but just spray the place to prevent the recount.
Meanwhile, Karen was trying to put out ONR.
And there are many more. And there are many more.
Meanwhile, Cummings is going to take away a credit.
But, Mr. Speaker, let me quickly address some of the things
Meanwhile, Cummings went
that the Honourable Member Cummins spoke about. Let's talk about maternal deaths. 2017, maternal deaths in this country was 23. 2018, maternal deaths 20. 2019, 23. 2024, Mr. Speaker, it was down to 14. That's our record. And 2 of those deaths were deaths of Venezuelan migrants that crossed the border, came to Region 1. We medevac them, brought them to Georgetown, but unfortunately they died. Every mother that died is something that we mourn. It shouldn't happen. But we have reduced maternal deaths in this country because of the investments that we have been making. You came here and you spoke about hospital beds. In your period, how many hospital beds have you added? 0. 0. 0. Later this year, in another couple of months, Mr. Speaker, 6 new hospitals would be open. 75 beds each. 75 beds each we will be adding. And when we finish there, we have the Ogle facility, 252 beds. You have New Amsterdam, 240 beds. You have West Demerara, 220 beds. And then all the hospitals, Maruka, another 50 bed. Let them, another 50 bed. Keto, another 50 bed. This is our record. This is the record. You came here and you said you will do primary health care once again because that was in your manifesto. What is our record? In the last 3 years, Mr. Speaker, 3 years, we have built 25 new health centers and health posts across this country. You come and said you want to train community health workers. When we came here, many of the facilities had no community health worker. Under this government, more than 500 community health workers were trained.
Look at them, and they want to know why they're sitting over there. Look at them.
Mr.
Why
Speaker,
they're sitting over there.
they talk about nurses. Who you think increased the salary for the nurses?
The People's Progressive
The
Party.
People's Progressive Party increased the salary for nurses.
But they love this.
And right now, we have 3,000 and more persons who would be graduating soon from nursing, assistant nursing program, and others. This year, we are also going to take in another 3,000 people. Mr. Speaker, I can go on and on.
Waste of time.
But I want to say to them that we have a track record to stand on.
That's correct.
You don't have anything to stand on.
That's correct.
And that is why we can confidently go back to the electorate, because they are proud of what we have delivered and they will re-elect us again.